In part 1 of this video, we talked about the measurements of the reproductive organs. In this video, we will be looking at the measurements of abdominal organs that are visible on ultrasound. Ultrasound doesn't just tell us what an organ looks like, it also tells us the size, and the size is very important. An organ that is bigger than normal can sometimes point to a disease. An organ that is smaller than normal can be a sign that something has been wrong for a long time. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. In today's video, let's go through some of the major abdominal organs that we measure on ultrasound, their normal size ranges, some common conditions that can make them enlarge or shrink. Let us start with the liver. The liver is the largest solid organ in the abdomen. On ultrasound, a normal liver measures less than 15 to 16 centimeters. It varies according to the height and sizes of people, but it should not exceed 15 to 16 centimeters. When the liver becomes larger than normal, we call it hepatomegaly. This can happen in conditions such as fatty liver disease, hepatitis, heart failure, and certain infections. On the other hand, when the liver becomes unusually small, especially with an irregular surface, it may suggest advanced cirrhosis, where years of liver damage has caused extensive scarring. The next is the spleen. The spleen helps filter blood and supports the immune system. The spleen normally measures up to 12 or 13 centimeters in length. When it becomes enlarged, it is a condition known as splenomegaly, and possible causes include malaria, typhoid fever, blood disorders, portal hypertension from a liver disease, and some infections. A spleen that has become very small may be seen in sickle cell disease, where repeated damage causes the organ to gradually shrink over time. Now let's move to the kidneys. A normal adult kidney is usually about 9 to 12 centimeters long and approximately 4 to 6 centimeters wide. When the kidney becomes enlarged, it may be due to acute infection, urinary obstruction causing hydronephrosis, inflammation, or occasionally a tumor. A kidney that becomes smaller than normal often suggests chronic damage. This may occur in chronic kidney disease, long-standing hypertension, chronic infections, or reduced blood supply to the kidney. Small kidneys frequently indicate long-standing irreversible disease. Next is the pancreas, which is responsible for insulin production. Insulin is the hormone that regulates blood sugar in the body. The pancreas is measured in parts. The head usually measures up to about 3.5 centimeters. The body is about 2.5 centimeters, and the tail is about 3.5 centimeters. An enlarged pancreas may be seen in acute pancreatitis or pancreatic inflammation. A shrunken pancreas may be seen in chronic pancreatitis, age-related atrophy, or long-standing diabetes. Let's move to the gallbladder. Unlike some of the other organs, we pay a lot of attention to the gallbladder wall thickness. A normal gallbladder wall should measure less than 3 millimeters or 0.3 centimeters. When it becomes thickened, we may suspect inflammation, liver disease, kidney disease, heart failure, or any other systemic condition. Finally, let's talk about the urinary bladder. The urinary bladder is a hollow organ, so unlike the liver or kidney or the spleen, we mainly assess how full it is and how the walls look like. When the bladder is properly filled, it should have smooth wall and thin lining. The normal bladder wall thickness is usually less than 3 millimeters or 0.3 centimeters. If the bladder wall becomes thickened, it may suggest conditions like chronic urinary tract infection, bladder outlet obstruction, or a long-standing inflammation. We also check for things like stones, tumor, or incomplete emptying of the urine after voiding, that is after using yourself. So even though the bladder is just a storage sac for urine, the appearance of the wall can give very important clues about the urinary tract. The next time you see measurements on your abdominal ultrasound reports, remember this. The numbers are very important, but also a number by itself does not make a diagnosis. As sonographers, we combine the sizes of organ with their appearances, your symptoms, and your medical history, and sometimes laboratory results before arriving at a meaningful conclusion. That is why understanding the numbers is useful, but understanding the entire picture is what really counts. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more ultrasound explanations that have been simplified for you, and I'll see you in my next video.